Professor Louwen is president of the International Federation of Gynecology and Obstetrics and a globally recognized leader in maternal and prenatal health. He is professor and head of the Division of Obstetrics and Fetomaternal Medicine at Goethe University Hospital in Frankfurt, Germany, where he has shaped clinical practice, education, and research in prenatal medicine. He has held leadership roles in numerous professional organizations, including president of the European Board and College of Obstetrics and Gynecology. Professor, thank you so much for being with us today, for accepting our invitation. I'm so happy to give you the stage to you.
Susanna, thank you so much, first of all, for inviting me to this remarkable Zoom meeting here with you. And additionally, I should say that I'm more than pleased to be part of that live panel right in the beginning of your meeting here with so numerous fantastic experts in the field, Christiana, Jaap, Robin, Priscilla, Debbie, and Laura. I'm really pleased to be part of that panel and to focus on what is a little bit withheld worldwide. If you look to the media, if a woman gets pregnant and she wants to get information, it's all about risk. It's all about what she definitely has to do to have at least a healthy child. And everything is just focusing on pathology. And we are forgetting what is more important, that women need best information, the best way to make their choice, what their needs are in that pregnancy, and to make sure that her environment, because she is the environment of a baby, that her environment fits with what nature expects. There is no doubt. And we have perfect description from our profession, what's happening in a baby that is named as fetal programming, that is named as epigenetics, that is named as fetal imprinting, and we get more and more knowledge what that means, but we are forgetting what is important. But today it is not my duty to discuss all these things, how the baby is related and how early a baby in the womb is related to her mother and how important that is for the rest of life of both individuals and the family. This is today not my point. I'm also not talking about the breech deliveries for sure. What my strong belief is that to support vaginal deliveries is not just only from the medical perspective important, but also from the psychological and from the family care. But today I just want to give you a glimpse of what FIGO is actually doing and how we are transforming. As most of you might know, FIGO, the International Federation of Gynecology and Obstetrics, is the biggest NGO on women's health. And that is surprising that we just can make that statement. But actually, FIGO is representing 142 member societies on Earth. And I'm very, very pleased because we have a huge member initiative actually to make sure that all low and low middle income countries get the support from FIGO. We're expecting to have another 25 members until we have our Montreal World Congress in the next year in 27. So we are still growing like the baby in the womb and the newborn then later in life. These members are so different. You cannot imagine. Actually, I'm traveling the world. You see behind me the United Nations, and I'm so proud. You cannot imagine that now we are moving forward, and that is really related to the topic you just gave me. How is FIGO moving forward when it comes to advancing global standards on maternal and prenatal health? Because the day before yesterday, I was pleased and honored to sign for the very first time a memorandum of understanding with UNFPA and FIGO. That is the first time that United Nations is signing a memorandum of understanding with a NGO. And this is because we are realizing that because we have that very close relation to the healthcare workers in all countries. And the UNFPA, for sure, as a governmental organization, has that close contact to the governments on Earth when it is related to health issues. So now we can start moving forward with developing projects with huge sponsorship from governments, from the big foundations on Earth, to make sure that women at least will have a better access for what is needed to have a healthy pregnancy for herself and for her baby. We should realize that, let me come from the part of violence against women and women in crisis. We have to realize that my colleagues working in Germany are in a beautiful situation. You have access to everything. You have access to all expertise, from not just only OBGYN and midwifery, but to psychology and to experts exactly in this field. But this is not the standard. Unfortunately, women in crisis, living in crisis, have to realize that they are in danger, not just only by bombing, not just only by soldiers, but also by violence against women. And we are very much focusing on these topics. You might know that FIGO has, and that is a machine of FIGO, more than 20 different committees with experts from all over the world and with all fields in women's health, not just only pregnancy and childbirth and postpartum period, but covering all the fields of women's health. And we have a huge division led by Finola McAuliffe from Ireland as a division director on exactly that field, what you are asking on pregnancy and childbirth. And here we make sure that with that expertise, we try to cover all these different topics. But FIGO is supporting our colleagues doing the research in the member societies. But for us, more important is to make sure that standards of care are implemented in all our member societies. In the past, unfortunately, we were in the situation that we knew very well the evidence and how important that is. But we realized on the other side that most of the low and low middle income countries had not the investment. They had no chance to cover what is needed, to give women access even to have just to see an expert in the field. And here I'm not only talking about OBGYNs, for sure. Here I'm talking about a midwife. So we made a big decision in FIGO, and this big decision will at least engage us for the next decade. I asked all our committees to develop in each topic they are covering the standards of care, evidence-based standards of care. And with that list, we are now reaching out to the governments in all our member societies, from low-income country to high-income country, to engage those who are healthcare workers on the ground and to make an agreement with the governments. So that is usually a list of 10 points. You cannot cover everything. We want to start with something what is practical. So we ask the governments, please pick 2 or 3 of these 10 points and let us make an agreement how FIGO can support you with all the financial support from the huge foundations and from the governments, from the European Commission, from the European Investment Bank, to make sure that in all these countries, women will have an access. If women only rely on what is written in the internet, we all know that this is more cruelty than information. It is wrongdoing, wrong thinking. So we have to make sure that our colleagues are educated, well educated, and that they have good guidelines. FIGO can produce guidelines for sure, but more important is that we have to join forces. And here is another big initiative. We are actually working and we are finalizing actually an agreement with the World Health Organization, with WHO. So in future, FIGO and WHO will be responsible to develop the women's health guidelines together, and not any longer different guidelines from different organizations. You cannot even read all this stuff, and you never know who influenced what in which direction. So we want to make sure that women have the best foundation, the best information, based on evidence, always, for sure, but that includes also, and that is so important, to make sure that in future women should have the same access to what is actually existing in the high-income countries. When I'm talking about high-income countries, again, we have to realize that we have countries with around 20% cesarean rate, like where you are actually based, Susanna, in Norway. That is fantastic. These people are doing an overwhelming, excellent job. But we have also countries in Europe and in high-income countries with a cesarean rate of 60 or 70% overall in the population. So we have to realize that there are many factors. I'm very pleased that the WHO Director Europe, Dr. Hans Kluge, is ready to work with us from the European Board and College in Europe, but also with me as the FIGO president, to make sure that we identify the reasons, and then we can work with these countries, with the population, with the member societies, and with the government to give women a better access to what is needed when we are talking about a calmful and peaceful pregnancy and childbirth. I'm very, very pleased that you are focusing on this topic, that you are pushing forward. It is so much needed. And from the bottom of my heart, many of you might know that I'm an obstetrician. I decided 25 years ago, when I took my professorship in Frankfurt, that I'm only focused on pregnancy and childbirth and the postpartum period, and not any longer covering the whole field. That is impossible. But here, to have the support from you, from all your fantastic organization, is so meaningful for us. It is so helpful. Sometimes you push us very much, and I like that more than anything else, because we need excellent influence from all of you. So from my perspective as the FIGO president, my strong belief is that FIGO is very fast moving forward to the right direction to make sure that women in all countries on earth, not depending on the GDP, not depending on the classification, whether they are low or high income countries, that women in future will have an access to those who are with high expertise related to that field. Thank you so much for inviting me, and for sure, if there are any questions, happy to answer. Thank you so much, Susanna.
Thank you, Professor Frank Louwen. It's so great to have you with us, and I'm so happy that FIGO is now starting to work with the United Nations as such a big achievement. Is one of the things that I think that helps with these big organizations, with all the good things and sometimes all the bad things also that come with a big organization and the bureaucracy that sometimes we need to deal with, so to make our causes move forward. But I think it's wonderful that in this way we can spread more the work that FIGO is already doing, which is wonderful. In this matter, I would like also, if any of you have questions, please put it on the chat. I have one that it's very dear to our organization, so I really have to ask, because one of the things that we see that there's lack of support for women is information. And information, it's not only on the hospitals or the daycare center, it's also through education. And when we think about pregnancy, a lot of times we think about the mother, the father, and the baby. And in our organization, we also have it's very dear in our heart, the youth, because our organization is made from, parents. And we think that we are doing this work because of the next generation. We want them to have the necessary information and care. So education, we also think it is essential on how we move forward. So I wanted to know your perspective in terms of how can we move forward so that the youth also knows more, is more prepared, and it's more informed, not only in the countries that are lacking resources, it is true, but I also see that here, for instance, in Norway, not all systems are perfect, of course. We all have a lot of things to do, but how can we advance forward in educating the youth about what is informed care?
Susanna, you are so right. In the past, we went wrong. We just wanted to make sure that the information is in place, that people have an access to information, and then we believe that this might have an impact on. Let us take the example with the cesarean that is very easy and very obvious, and there is so much evidence about that. So what we learned is with producing more information to make sure that women might have the choice to have a vaginal delivery, these countries increased with cesarean rates. So it was senseless. The thinking was in the very best way, but we failed with that approach. And you're 100% right. We have to start much, much earlier to get better knowledge. We try that. We start with our member societies. Even there, most of our colleagues, when it comes to obstetrics, lost their skills. They are perfect in fetal scanning. They are perfect in the description of whether the brain development of a baby is right or wrong in the first trimester. But we have to realize that there is so much more to make sure that this is a healthy pregnancy. It is not just only to sort something out. It is so much more important to make sure that people have a better understanding what is right or wrong to do in pregnancy, to develop a peaceful and truthful relation in pregnancy to those who want to make sure and who care for women and her baby, the family, the whole surrounding. So for example, I can give you an example what is quite helpful when we are talking to politicians and how to implement education early in schools, early with the population. What we learned is that women who are in a prematurity situation, not giving birth premature, but in a prematurity situation, that their babies later in life have a higher likelihood for psychiatric diseases. So the thinking was that it is a prematurity. It is the premature delivering of the baby related. Today we learn that it is how we treat the women in that situation and how important psychology is on this topic to make sure that that situation, the expectation to have a preterm born child is more important than the preterm born child, at least. So we are in a learning process on our side as well, and to educate that as early as possible, to recognize the situation, to have not just only help from an obstetrician or gynecologist, but to have the access and support from people in that field related with their expertise is so much more important. So that is evidence-based. Many people are thinking evidence-based medicine is wrong. I can tell you it's right. We have to prove whether something is right or wrong, and then we have to move forward and make sure that women have an access in that important time. So you're 100% right. Education starts in schools. So to develop a situation that a pregnancy might be a peaceful and beautiful time, that giving birth is one of the most beautiful events in a life, to make sure that this could happen, also to make sure that women have, if something's going wrong, if there's any pathology, then this has to be covered in the very best way. That gives us this peaceful situation in labor. But again and again, also 70 years after the founding of FIGO, we have to realize that this way is just in the.
Yes, yes, and it's not only the organizations that are doing a work in progress. We ourselves are a work in progress. So I think that's also important to say. I have a couple of questions here. Nancy Karabekir says, I'm from Istanbul and like to learn from your point of view about obstetricians' birth traumas. How can we resolve it?
Obstetrician birth trauma, whether the obstetrician is the birth trauma or whether obstetricians are producing birth trauma.
I would say that would be probably the professional that sometimes goes through also the trauma of birth.
Oh yeah, for
birth.
sure. For sure. That is workforce and how we deal with that situation. And all these topics are for sure extremely important, and more people are focusing on these different parts. The solution is not easy. I mean, we have to realize that although I would make the choice always again and again to become an obstetrician because I really love that profession. And it is an unbelievable privilege for all of us to be part of a childbirth and to be part of what is happening with these two grown-up individuals and their baby. It is an overwhelming situation. I would never change my profession for sure. But on the other side, we have to realize that more and more young doctors and medical students are not any longer interested because for so many reasons, disrespectful treatment, justice complications. I could name a long list, and we try to make sure that this could be covered better in the future. On the other side, it is also that quite often in societies, in member societies, the focus is not any longer on obstetrics because quite many people, colleagues, are realizing that working in the night for hours and hours to make sure that this woman might have a beautiful experience, and comparing that to 15 minutes cesarean section to deliver a child, if they just see the newborn as the outcome and not what happened to the newborn, what happened to the mother, what happened to the family, what the impact is. So if you shorten it just to the effect that the newborn is born, then this is a very short view on that profession and what we are focusing on. So many things to mention here. The obstetrician might be a problem, but also how the obstetricians are treated, and the midwives for sure, and everyone else who is involved in labor.
Yes. Another question here is of Dr. Akan Shoker. We have seen him is one of our supporters for the World Pregnancy Day. He asked, is it possible to bring the prenatal education, birth psychology, and physiology education to obstetric basic first month education?
Well, how beautiful that would be. I think at the end we should come together and develop ideas how media could change the view of the population and the politicians. If you just ask your Minister of Education to do something here, I'm not pretty sure whether that could help or not. But I really believe that we have to move forward with huge media companies to educate people in that way. The accessibility is much better than anything else. If you just have 4 hours or 6 hours in education of pupils, what would that mean? Nothing at the end. I even don't remember whether we talked about that in biology in I don't know 6th or 7th class or something. But if you produce and I think that is what we have to focus on. But then you need also financial support. But I would love to start that discussion with you, with all your organizations, how we could focus on that, how we could start the discussion with media. And I think our accessibility is not too bad to do so.
One of our advisory members is Dr. Joe Evans, and he's also an obstetrician. And one of the questions, he was also part of our summit, but one of the questions that I made him was, this view of the importance of pregnancy, of the experience of pregnancy, because the baby is learning about the outside world through the mother's experience, the experience of birth itself. All this message is very welcomed by parents, by doctors, by caregivers. But it still feels that it's not yet being in practice. So what is missing? And he said it's missing in the manuals where they study. It's not written in the manuals. So this is something that I think it needs to be pushed forward, is the educational system to also, and I think Dr. Akanchukera was also talking about that, it is important to be in the educational system. Mafe is asking here, which I think is a wonderful question. So what, ideally speaking, would be the role of birth professionals in the world of tomorrow? In a world where all couples would be aware of the message spread by Prenatal Alliance, would it be different from today?
I mean, I cannot say more than just I'm extremely supportive to that idea. But what we could start in the beginning is, and that start is not too bad. We have good experience with that. Why don't we sit together from these leading organization and just write an editorial to the Lancet? So the new Lancet edition of Obstetrics, Gynecology, and Women's Health is extremely supportive, and they are pleased to implement also education in this field. So maybe Susanna, you take a lead, bring the colleagues together. FIGO is all in, and then we start that journey. The visibility is extreme. And I think then you engage the right people. We can do that as well in FIGO, in our committees for sure. But we should spread that idea. It is not news. It is to spread that idea through all our colleagues and organizations. So this
Yes.
journal wouldn't be so bad for that.